In Sweden, what seems to have happened is an outburst of pragmatism.
Sweden have effectively combined tobacco control with really sound harm reduction strategies.
They've now become almost the first country in the world to go smoke-free, where you have a smoking prevalence of 5% or less in the adult population. Sweden has achieved that.
For 30 years in New Zealand, we have been citing Sweden as an example of how to reduce smoking.
What I think about Sweden is snus.
First thing that came to my mind when I heard about Sweden is snus.
That snus does provide the ingredient that does not cause cancer, that is nicotine, for which people smoke or use smokeless tobacco in any form.
Sweden is the first country that used the snus to successfully reduce the prevalence of smokers.
I first heard about the product 15 years ago, and I've always been advocating for this to be tried in my country.
Lo primero que se me viene es gente muy alta, rubia, con ojos azules, pero gente que está sabiendo aplicar correctamente unas políticas de salud pública de forma apropiada.
São pessoas que cuidam da saúde e são pessoas que conseguiram um nível de prevalência de tabaco incomparável no resto do mundo.
Suecia creo que ha hecho todo bien, empezando por la educación, brindando buena información, regulando y permitiendo todas las alternativas a los fumadores.
Y curiosamente, utilizando alternativas de reducción del daño, no tienen más casos de cáncer. Por lo tanto, creo que es una imagen, un país donde otros países debemos mirar, donde los profesionales debemos entender qué es lo que están haciendo, cómo lo están haciendo y cómo queremos incorporar esas políticas de reducción del daño a nuestros países.
Sweden has the courage and the facility of independent thought to make sure and to provide their adults with a series of choices, trusting them to make the right choice.
They have listened to the consumer.
I think what they're doing there is great. Putting the voice of consumers ahead of the policy discussion is always of importance.
Permitiendo también a sus ciudadanos, o bueno, a los tabaquistas o a los fumadores, mejor dicho, tomar decisiones conscientes e informadas y sobre todo libres.
It shows what can happen in a world when you listen to consumers rather than dismiss them off.
Sin prohibir, sin estigmatizar y escuchando a los diferentes grupos, tanto científicos como de usuarios, para conseguir tener esas cifras tan maravillosas de tabaquismo y de cáncer en Europa.
If people are concerned about their health and about smoking, they know which products to switch to if they want to improve their health. So they're better informed. When they make purchases of these products, they understand the relative risks of the products because there's information.
Pragmatism, courage, and common sense.
Que nosotros como latinoamericanos tenemos que aprender mucho de ellos, que la prohibición no lleva a nada bueno y que una regulación sí.
We have to follow Sweden in how they perform research, studies, and make evidence-based policy in reducing prevalence of smokers.
El ejemplo de Suecia yo creo que es aplicable en la mayoría de los países. No importa las cuestiones de desarrollo socioeconómicos o culturales, porque realmente se han basado en principios muy simples, en brindar buena información, buena capacitación, buena educación.
España tiene que aprender que la reducción del daño es una vía más para que los pacientes consigan dejar de fumar. España tiene que aprender que se puede regular perfectamente con políticas tanto económicas como de salud pública aquellas herramientas de reducción del daño, aquellos dispositivos para la administración de nicotina sin combustión.
Y tener el libre acceso bueno, tanto a las decisiones como a los productos.
India should look at Sweden as a role model. They should emulate Swedish model of snus or equivalent, but basically pouched, cleaner form of tobacco to get the purer nicotine without other harmful products.
Y además España tiene que aprender cómo ha sabido englobar, sin perder parte de su placer o parte de las ganas de consumir esa nicotina, cómo han sabido cambiar para no tener la combustión y las enfermedades asociadas al tabaco.
O grande problema de você hoje ter nesse debate de redução de danos do tabagismo é a falta de informação, a ideologia e é uma falta de uma abordagem mais pragmática para que a gente tenha um impacto positivo na saúde pública.
For those who are against snus or other smoke-free nicotine alternatives, they would always say that Sweden is an outlier. It's an exception. It's because of ABBA. It's because of herring. It's because they're all blonde, blue eyes. I would argue that those are all false assumptions. And in the world of science, where lives are being lost by people who smoke cigarettes, that's also an irresponsible statement.
New Zealand set an aspirational goal to meet 5% by 2025. We're nearly there, but we haven't done what Sweden has done. We haven't adopted tobacco harm reduction in its fullest extent like Sweden has done.
Sweden already managed to reduce the prevalence of smokers because they have good strategies as well as good research.
There's a lot of data in Sweden about harm reduction and about the effectiveness of these alternative products. You know, there's data there now, but we need people to look at the data. So we need other countries and governments to take note, look at the data from Sweden, accept that Sweden have got that right.
I would give it a bit like 10 years. If this is emulated, especially in the low and middle income countries, then we're able to achieve smoke-free status, even in Africa as well.
The Swedish lesson and the smoke-free Swedish learning or case study should be taken seriously by WHO and other governments.
Então, enquanto nós tivermos políticos, interesses pessoais e ideologia, nós acabaremos andando para trás e não para frente.
I think India can do a huge public health favor towards its population.
So I do not agree that other countries cannot learn from Sweden. I think the data is there, the learnings are there. It's a case of being able to admit that what they're doing might not be working and then be open-minded to look at what Sweden has been doing to drive smoking rates down to a very low level of 5.6%.
So if the government can emulate what is happening in Sweden and apply the same regulation in Kenya, then we can also achieve this remarkable 5% smoking rate in the country.
Si Suecia lo estuviera haciendo mal, ¿cómo tiene estas cifras tan buenas?
Sweden is the actual example of what can be achieved. They've achieved 5%. So we should be able to too.
Son principios muy básicos y fáciles de aplicar, y eso creo que es lo más interesante del ejemplo que nos está dando Suecia en cuanto a reducción de daños por tabaquismo.